My name is Bruno Rosa. I am a gastroenterologist from Hospital da Senhora de Oliveira in Guimarães, Portugal, and an investigator at the School of Medicine of University of Minho. And I am here to tell you about our recently published paper, Pan-intestinal capsule endoscopy as a first-line procedure in patients with suspected mid or lower gastrointestinal bleeding, co-authored by Tiago Cúrdia Gonçalves, Maria João Moreira, Francisca Dias de Castro, and José Cotter from the same institutions, Bernardo Sousa Pinto from the Faculty of Medicine of the University of Porto, and Mário Diniz Ribeiro from the Portuguese Oncology Institute of Porto in Portugal. We decided to perform this study because we believe that in the setting of suspected GI bleeding, patients should receive the most effective, safe, and least invasive modalities for the diagnosis before proceeding with further invasive procedures that might be required in some cases to biopsy or treat the lesions. We know from the literature that in patients with iron deficiency anemia, the diagnostic yield of upper endoscopy and colonoscopy ranges from only 25 to 30%. And in patients with melena, the diagnostic yield of conventional colonoscopy after a negative upper endoscopy is even lower, below 5%. But nonetheless, according to the current standard of practice, after a negative upper GI endoscopy, patients will generally proceed to colonoscopy, and then this is followed by a small bowel capsule when the colonoscopy is also negative. More recently, it has been described that double-headed capsules offer the unique opportunity to combine the evaluation of several segments of the digestive tract at the same time in a single, non-invasive examination. This is the concept of pan-enteric capsule endoscopy. So in brief, we developed a prospective study including 100 consecutive patients with suspected mid or lower gastrointestinal bleeding to evaluate the accuracy of pan-intestinal capsule endoscopy compared with colonoscopy for the diagnosis of potentially hemorrhagic lesions. These lesions, overall, were diagnosed in 46% of patients in our series, and though they were correctly identified in 96% of the cases with the capsule and only 50% with the colonoscopy. The capsule allowed invasive procedures to be avoided in more than half of patients. This means that the majority of patients, according to the current practice, are often receiving unnecessary invasive colonoscopies, which in our series were associated with a 2% risk of complications. It was concluded that pan-enteric capsule could potentially be a first-line examination in patients with suspected mid or lower gastrointestinal bleeding. Based on these observations, we proposed a new algorithm where patients presenting with anemia or overt bleeding after a negative upper GI endoscopy should proceed to pan-enteric capsule endoscopy, and thereafter those requiring biopsies or therapeutic endoscopic interventions should proceed to conventional colonoscopy, device-assisted enteroscopy, or in some cases a second look upper endoscopy, depending on the type and location of the lesions identified by the capsule. Thank you for your attention.